All right, we're going to get started. I want to thank you guys all out for coming. My name is Josh Wynn. I'm the program coordinator for Buckeye Wellness. Before we get started, just a couple announcements. As you guys can see on the screen, we do have a couple upcoming events. Our annual Amazing Race to Wellness, which is on May 16th over at Lincoln Tower Fields, and our Buckeye Path to Wellness walking event, May 4th at our walking path. So if you guys look at the links there and register for those events. We also are offering 2 new fitness classes. One is a running group held at Fred Beekman Park starting next Thursday, and then beginners yoga over at UHE starting the following Monday. So register online. You guys can visit the websites there for upcoming events. A couple house items. You guys all received little turning point clickers. So there are a couple slides and Dr. Messina's presentation that we asked for you guys to participate in. So that was the little square little thing that we handed out. So use those, and then there are black boxes on the way out that you guys can return those to. And there will be some time for questions at the end, so please hold all questions until then. All right, well, I'd like to introduce our speaker today, Dr. Messina. He is an assistant professor of practice and division of general practice and materials science at the Ohio State University College of Dentistry. He is also the clinical director of outpatient care dental clinic located in Upper Arlington, over at Upper Arlington's Wexner Medical Center outpatient care facility.
It's a mouthful.
Yeah, it's a mouthful.
For a long business card.
Right. For the past 30 years, Dr. Messina has been a practicing general dentist in Cleveland and recently joined the College of Dentistry in June 2017. Dr. Messina is recognized nationally for his presentations and his publications on issues related to dental ethics, as well as his lectures on leadership skills that allow dentists to provide optimal care for their patients. He is currently a consumer advisor for the American Dental Association, serving as the national spokesperson since 1995. Throughout his career, he has appeared on ABC's Good Morning America program and has been interviewed on CNN, National Public Radio. He has also provided comments on dental health and related subjects for USA Today, the New York Times, the Washington Post, Cosmopolitan, Men's Health, WebMD, and Prevention Magazine. Please give Dr. Messina a warm welcome.
Thanks, Josh. I appreciate it. Thank you. Can everybody hear me okay? Are we good? Okay. And we're also being live streamed out to the audience throughout the rest of the WexMed world. So we'd like to say to everybody, wave, say hey to the crowd in the audience here. It's a beautiful day. You should be here. We miss you. The salads are good. Next month is May 11th, so make a point of being here. It's my pleasure to be here with you guys today. I do really appreciate everybody's willingness to come out on a beautiful day. So now the pressure's on me to make it worthwhile for you guys to give up sitting in the sun for 45 minutes while we're talking. There it is. Okay. So one of the reasons why, I spent more than 30 years in private practice and then got brought back into the College of Dentistry. I graduated from Ohio State's College of Dentistry in 1987. Get this figured out. So for 30 years, I practiced over here, West Side, suburban Cleveland, Ohio. I had a general private practice, an adult restorative practice. Now, we practice over there. And the dental clinic is this end of that building facing Zollinger Road. And I'm here because for 25 years doing this job, in addition to my other job, what the consumer advisor spokesperson gig means is if somebody calls the American Dental Association in Chicago and they're a reporter, or they call the Ohio Dental Association here in Columbus and say, we need to talk to a dentist about whatever the pressing issue of the day is, I'm one of a couple people that will get routed to. And I spent 25 years attempting to connect dentistry and medicine and interdisciplinary care, cooperative care. So the dean of the dental school came to me about a year and a half ago, that's closer to 2 years ago now, and he said, hey, I want to take you to lunch, and we're about to build a new building. We're going to break ground in a couple weeks on a new building, so I figured you wanted money. And my first thought at the time was, well, maybe I'm busy. But I said, no, come on up, let's talk. So the idea was the Wexner Medical Center was building this building, and they wanted a dental clinic in the building. What the dental school needed was someone with private practice experience to take over as director of the clinic and run that aspect of things. And so the dean came to me and said, we're building an interdisciplinary care building. You've been saying for 25 years that you believe dentistry and medicine have cooperative overlap and really should be working closer together. He said, would you like the chance to prove it? And when somebody looks at you and says something that you've been saying for most of your life, that you get the chance to make the rubber meet the road, well, that's why I'm here. And that's why, in a sense, we're here today. So, as we move along, when you look back through history, and we're going to tell stories as we go, because actually one thing that didn't come up in the bio is, in addition to other things in my free time, I'm a published novelist, and I have copies of the books. If you stick through to the end, we have door prizes. In addition to the toothbrushes that are out there, I have a couple of door prizes. So we've got 4 books that we'll give out at the end. But one of the things I've learned in talking to people over 30 years is the best way to get people to remember things is by telling stories. So, for the purposes of today, once upon a time, in the beginning, dentistry and medicine were one profession. And in fact, we go back 5,000 years. The first recorded dentist, Hesi-Ri, was an Egyptian physician who wrote extensively on dentistry. We know this because he left records of it, and that actually is his tomb. The sands shifted outside of Cairo near the Pyramid of Saqqara. In about 2006, somebody fell in a hole in the ground and discovered 3 tombs that had never been discovered. They read the hieroglyphics, and if you read the hieroglyphics, this little symbol right here that you can't see in the back is an eye over a tusk, which in ancient Egyptian hieroglyphics is the symbol for dentistry. So 5,000 years ago, dentists were keeping their eye on people, saying, did you floss? Okay. So this tomb's dated to 3000 BC, and the inscription reads, the greatest of those who deal with teeth and of physicians. Can you imagine being the physician to the pharaoh? You know what that must have been? The most powerful guy in the world sits in your chair, and you have to look at him and go, Pharaoh, dude, about the breath. Did you floss? It would have been much easier to just say, looks good. See you in 6 moons. So, anyway. But they were fairly advanced. I mean, this is before Invisalign, obviously, made it to Egypt, but that's a 4,000-year-old mummy. One of the things that the Egyptian physicians and who were practicing dentistry realized that if you have a toothache, that it's too much pressure in the tooth. And without any knowledge of bacteria or anything like that, they thought that there were evil spirits in the tooth. So if you drilled a hole into the tooth and released the evil spirits, the pressure would go away and make the pain go away. They had half of a root canal right 5,000 years ago. Now, we also, since some of this research was done, they have CT scans of mummies that show teeth with holes in them and then a gauze or muslin kind of material that, according to their records, was soaked in myrrh, as in gold, frankincense, and stuffed into the tooth. It was a pretty successful obtundant, and then they put beeswax over the top as kind of a long-term temporary material. Fairly successful for that level. Now, the challenge was they had such success with drilling holes in teeth that they tried to apply this to headache. And, well, with mixed results. And for the first guy to complain of a headache, and they did this to him, that wasn't necessarily so good, but it was kind of a form of a vaccination, because once one guy complained of a headache, nobody else in the village ever complained again. So you talk about herd immunity. I mean, you treat one guy this way, and, you know, according to them, they fixed it. They had all the problems solved. Okay, now it's question time. So the first, or a physician, ancient physician who wrote extensively about the development and care of teeth. We can see the poll here. This is your chance to use your clickers, A, B, C, or D. Who do you think the right answer is? And, okay, the 4% of you that are rooting for Dr. Oz, he was on this morning. I don't think he goes back that far. So we're like an Andreas Vesalius, right? Okay. Well, actually the answer is Hippocrates. when he wasn't doing that oath thing, he was chronicling the eruption pattern of teeth, when baby teeth came in, when they fell out, when the permanent teeth came in. He had the first numbering system for teeth. It's not the one we use right now, but he actually numbered the teeth, and he talked about extracting teeth with forceps, stabilizing teeth with wires. The tooth stabilization with the wires he stole from the Egyptians, but they weren't around anymore to complain. Egyptians used the first toothpaste we have records for, wine vinegar and powdered stone. Wealthy Romans using slaves to brush their teeth. Not the job you really wanted, I don't think, at the end of the day. So the first scientific abstract written on tooth whitening. This is your second vote chance for the day. Everybody made a choice? Okay, all right. Actually, Pierre Fauchard's not a bad guess. He's considered to be the founder of modern dentistry. The 13% of you voting for Andrew Thomas, as far as I know, the chief medical officer of Wexner Med Center has not written a pamphlet on tooth whitening, but the brownie points will be officially noted. We'll send that along, and you'll get the extra score. Okay, so the right answer is this guy. 16th century French physician and apothecary Nostradamus wrote the first scientific-based pamphlet on tooth whitening. And he kind of predicted that aesthetic dentistry was going to be a big deal. So for over 5,000 years, dentistry and medicine were one profession. So how in the heck did the mouth get separated from the rest of the body? And the answer is this guy. William Geis. He's a PhD, biochemist. He was asked, and he chaired a commission in the mid-1920s. The report came out in 1926, looking at the status of education, dental education, and moving it from more of a trade and a sidebar of medicine into its own specialty. And he advocated for university-based dental education. So he's kind of the father of the modern dental school, which was fabulous for dentistry. It's done wonderful things for the profession. The sad part here is under the law of unintended consequences, the problem is all of a sudden physicians went to medical school, dentists went to dental school, and the mouth got separated from the rest of the body. Because I don't know about your medical training, but I have a son that's a third-year medical student. The average level of understanding of dentistry among my medical colleagues is about where it is for the general public, maybe a little more, okay? Some have taken a great attention into it, but in general, people keep the two pieces completely separate, which once again is why I'm here. I have to give credit to Farmers Insurance, because they have given me a lot to say. I love the guy here, and since I've been practicing dentistry for more than 30 years, one of the things I tell patients all the time is, because I've seen a thing or two, I know a thing or two. And among the things or two that we know is these are the known oral health associations or the known crossover points between dentistry and medicine. These are the things that have defined research that show an overlap. So in what you treat every day, how many things are not on this list or related to this list? What part of what you do isn't here? Probably not a whole lot. There's a lot of overlap. So my job in the 4 hours or so we have left, sorry, just kidding. My job in the next 20 minutes is to try and give you a reasoning for considering dentistry as you practice medicine. Because I spend a lot of time talking to patients. That's one of the nice things about my job. I treat patients 3 days a week in Upper Arlington, so it is a faculty practice. I'm on faculty. We practice in the community. And then 2 days a week, I'm just up the street teaching the dental students in the dental school. So I get to talk to these people all the time. And it's amazing the discussions we have with patients. You'll look at them and say, Mr. Jones, I'm seeing some signs of early periodontal disease here. This is something that we need to address. We really think that this is something that's going to be important for your overall health. Why don't we talk about how we're going to treat this disease and make it better for you? And the patient says, but, okay, so when I brush my teeth, my gums bleed. It's not a big deal, right? Well, Mr. Jones, if every time you washed your hands you had blood running out from under your fingernails, you'd run to the emergency room, right? So why is this okay? And it dawned on me, after a while, that patients think their mouth is like Vegas. What happens in the mouth stays in the mouth, right? Little bleeding gums, no big deal. So let's do a little bit on periodontal disease. We're going to leave most of the profession of dentistry on the table today. We're just going to stick on periodontal disease. Bacterial infection that destroys the gums and teeth surrounding, or the bone support surrounding the teeth. Responsible for 70% of adult tooth loss, affects 3 out of 4 people at some point in their lives. So that's a pretty prevalent disease. Okay, that's a pretty significant issue. In the tooth, we have bone surrounding the root of the tooth. There's a little fiber layer here called the periodontal ligament that holds the tooth in the bone. We have gums over the top. And that little spot that you move floss in next to down in here, called the periodontal pocket, is where all kinds of food and bacteria and everything else gets clogged up down in here. And the challenge here isn't that the bacteria eat away the bone. It's that the presence of the bacteria here when they stay, it's the body's response to that that's the issue. It's the inflammatory response. And the body senses there's something in here it doesn't like. And so what the body's doing is dissolving away the bone to get this out. And eventually, left untreated, the body will win and will take the bone all the way down, the tooth will come out, and then the gums heal over and the bacterial assault on the body's gone. But we've lost a tooth to do that. So the question here is, the point is, how do we treat this so that we can stop all this from happening? And what's the effect systemically of having that bacterial load where it can get into the bloodstream? Okay? Question so far? We good? Good so far, okay. If you do have a question, you don't, I will take questions at the end, but please feel free. If I say something that sounds completely weird, wave, and we'll address it at the point. So what are the signs and symptoms of periodontal disease? Red, swollen, tender gums, bleeding while brushing and flossing, receding gums, toothache, loose or shifting teeth, change in bite, persistent bad breath, pus between the teeth, tooth loss, or general crud. And if we clean the crud off, it's amazing how much pinker and happier the gum tissues get. Because I promised it's lunch. I'll try to minimize the gross pictures. I could have been much nastier than this. I'm trying to be nice. Okay. Stage, and periodontal disease comes in stages. You know, the early stage gingivitis, gums are red, swollen, tender, gums bleed easily. But here's the key. There's been no bony involvement. This is all a soft tissue disease. So if we catch it here, it responds very quickly, and everybody's happy. The chronic periodontitis aspect of things add all of this stuff, and then add changes to the bone, and then the advanced case, we have significant bone loss. Or where we're starting to see bone loss. This is bone changes that show up on x-rays, which is why we take radiographs of the teeth. And this is significant bone loss, and recession, things like that come into play there. Okay, I do have one scary slide coming up, so you know if you're squeamish, avert your eyes. Okay, there we go. So this is the bad guy, Porphyromonas gingivalis. There's lots of P. gingivalis to its closest friends. Anyway, non-motile, gram-negative, rod-shaped, anaerobic, that's the key, pathogenic bacterium. Lots, now the mouth is not a sterile place. It's never going to be a sterile place. But the game we play is reducing bacterial load. So by brushing, flossing, doing all these kind of things, we're trying to play a numbers game, reduce the numbers. But among the bacteria present, and there are a lot of them, this is the guy, you know, remember this, we only have lunch, so we've got to trim this back. This is the guy we're going to concentrate on, okay? So let's look at the way things come together. You know, what's significant here? Cardiovascular disease, the #1 killer in the United States, especially men. So having the bacteria in the bloodstream, we have damage to the vascular endothelium, the highest level of C-reactive protein in patients with most advanced periodontal disease. This was one that I found kind of interesting. P. gingivalis was found in 100% of plaques. Wonder how it got there. It certainly didn't stay in Vegas. So. The antibodies to P. gingivalis are elevated in MI patients. BOP is bleeding on probing. So if you have periodontal pockets greater than 4 millimeters, it's not that deep, okay? Bleeding on probing and tooth loss, even if you take out all the other known risk factors for cardiovascular disease, the incidence is correlated in past MI. So there's an association found between chronic periodontal disease and patients that have had an MI in the past. So much so that if you've got bleeding on probing on more than 50% of your teeth, you now have a 4 times higher rate of having had an MI in the past. Okay, so we went to Vegas and had an MI. But let's look ahead. All right, we've got 129,630 participants. They couldn't get a couple more? Anyway. Patients with periodontal disease have increased risk of MI. Okay, so not only is it in the past, it becomes a risk factor or predictor going forward. And this was kind of the big one from 2016. Even after adjusting for diabetes, smoking, and education of the patient, in the largest study to date, periodontitis can be looked on as a risk factor for first-time MI. So if we want, and we control risk factors, right, for diseases, or we try to. So maybe we're making the case for this one being on the list. Okay, well, this is the number 3 killer in the United States. 2.6 times higher risk for cardioembolic stroke, 2.2 times higher risk for thrombotic stroke. So now we're saying that periodontal disease is an independent risk factor for strokes. And interestingly enough, they had a population study in Taiwan where they treated patients for periodontal disease and also some with just dental cleanings and were able to reduce the risk of stroke. Okay, here's another one in the top 10. Significant reduction in HbA1c and fasting blood glucose seen in patients at 3 and 6 months follow-up after root planing, scaling and root planing. So we scaled and root planed people, and 3 months and 6 months later, they were still getting a benefit on their control. Retinopathy significantly associated with periodontal disease, significantly more renal complications, neuropathic foot ulceration significantly associated, cardiovascular complications. So not only are we treating the disease or dealing with the disease itself, but it's enhancing the sequelae of the diabetes. Pattern developing here that we're starting to see maybe? The number 2 killer. So I've already got 1, 2, 3, and diabetes is like 6, but if you look at all the other things around it, it's probably a little higher than that. 24% higher risk of primary cancer in patients with severe periodontal disease. 28% higher risk in patients who are edentulous, meaning they've lost all their own natural teeth. And we'll come back to some of these things later. Among male never smokers, periodontal disease was associated with a 33% increase in smoking-related cancers. And those are the classified as lung, bladder, oropharyngeal, esophageal, kidney, stomach, and liver. Well, that's a couple cancers. Those are some pretty nasty cancers. So never smokers, people that never smoked, that have periodontal disease have a 4 times greater risk of getting lung cancer. Isn't that interesting? Put that one aside for a minute, because we're going to come back to that one in a couple minutes. This is why it needs 4 hours. Anyway, go ahead. Okay. Rheumatoid arthritis. Not a killer, but a lot of people are pretty miserable with this one. If we treat the periodontal disease, we see a reduction in the number of tender and swollen joints. So this one, it's considered to be an aggravating factor. And it's because of the inflammatory component, the body's inflammatory response to that bacterial load. So if we can reduce the bacterial load, reduce the heightened immune and inflammatory response in the body, we may be able to improve people's rheumatoid arthritis just by treating their periodontal disease. And isn't that a simple thing to do that might make people better? Now, I don't know who authorized this study, but the administration of P. gingivalis in middle-aged mice caused learning and memory deficits. That was a bad day for the mice. However, it is interesting, and this is an emerging area of research. I'll give it this. But the interesting part about this is that severe periodontal disease, so these are the people with worse problems, throw a strong association with Alzheimer's disease. I found this one fascinating. P. gingivalis frequently found in autopsied brains of Alzheimer's disease patients, but not in normal brain tissue. How did it get there? And now, and I heard a murmur in the back that's exactly, you're right on the money. That's the next slide. Causation was not established, okay? I'm not leading A to B, but there is an interesting interventional study that's ongoing that is showing that if you treat periodontitis, you can improve the cognition. Which is also, for a really evil disease, if there's something fairly simple we can do that might make things better, maybe that's not a bad thing. Oh yes, let's get to that. Now we're to my favorite study. I was in Washington, D.C. in February, and I'm on the American Dental Association's Council on Governmental Affairs. I represent the dentists in Ohio and Indiana. And we received presentations from a lot of the federal services, and the head of VA dentistry was so excited about this study that they presented it, and I have to agree, this is kind of interesting. So in the VA in Roanoke, Virginia, this was done in 2017, the nursing staff made a commitment to have all of their inpatients brush their teeth twice a day. Just either watched them or assisted them brushing their teeth, standard toothbrush. If they had dentures or partials, they took them out and cleaned them and put them back in. So, and they were looking at pneumonia. So what do you think the rate of reduction of the pneumonia was just by brushing the patient's teeth twice a day? These are inpatients. Okay. Well, let's see. All right, 56%, probably a good guess. The answer is now 92%. That's pretty amazing. And there are studies ongoing, there's past evidence and studies ongoing that for ventilator-assisted pneumonia, I mean, obviously those patients can't brush their own teeth, but having the staff, even as little as putting a little chlorhexidine on a 4x4 gauze and wiping off their teeth, is reducing ventilator-assisted pneumonia as well. So the thing about this, and I love this, this is the motto from the nursing staff at that particular VA: every patient, every shift, every day. That would be 3 times a day, well, depending on the 12-hour shifts and things like that, but that's a lot. And these are inpatients, so they're under guided care. But now this is the VA, so this is their numbers people, which is on a big, a case of pneumonia sets a patient back by 2 weeks. They have to stay in the hospital longer and costs $40,000 to treat. The mortality rate is 18 to 19% from hospital-acquired pneumonia. So according to the VA, that over time will save more than 1 million cases of pneumonia, save $4.6 billion, and prevent 200,000 deaths. Now, some of that is taking a small pilot study and blowing it up on a big scale, so that's there more for shock value, so to speak. But what I'm more concerned about is looking at individual patient care, individual decisions that we can make. And so simply on the floor, if we just reminded patients to brush their teeth once every shift, and if we could get 1/3 of that as far as an improvement in overall health care, what a difference that could make. And it's simple to do. In fact, the VA was so excited that they've created, this is a poster of theirs. The thing that I found funny with this, because when I saw this, and I called the guy from the VA and talked with him about it, because on the bottom here it says, brushing your teeth lowers your chances of developing hospital-acquired pneumonia by 30%. I said, well, your study was at 92. He said, yeah, we thought nobody would believe that number. It was too big. So they made a number that was plausible. So, anyway. Now, I couldn't be up here as a dentist without, my take-home lesson of the Healthy Four. And this is for everybody, inpatients, outpatients, all of you. Now, I know all of you are here interested in wellness, so this isn't a big deal. I'm preaching to the choir here. But out in the community and everything else, if you just brush twice a day, floss once a day, eat a healthy diet, see your dentist on a regular basis, you're advancing things tremendously, okay? I tell patients all the time that if they want to be, if they want to be in the top 10%, just floss every day. And if you do all of these things on a regular basis, what a difference that can make for your overall health, and definitely for patients and people that you love and care for. And when we're brushing our teeth, make sure we get the toothbrush angled, get all the sides of the teeth, including the insides and back sides of the lower front teeth, back sides of the upper front teeth. When you see your dentist and hygienist the next time, ask them, they can help you. And how to floss. If you wrap it around the middle finger, you get control of the floss better, which lets us be better able to get in here, because the goal is to get the floss in here, underneath the gum line, where our happy anaerobic bacteria like, because this is a nice, warm, moist, dark, oxygen-lacking area. And so our P. gingivalis loves being right up in here. So, let's talk a little bit about the future. Why are we here? What are we trying to accomplish? Peter Drucker said the best way to predict the future is to create it. We're part of, we have a wonderful advantage here on campus because the dental school is half a block up the street. We have a cancer hospital, a heart and lung research. We've got it all. And out in Upper Arlington, we have the blessing of a 150,000 square foot or so outpatient care facility with a dental clinic, an optometry clinic, and all of the major specialties. That's a wonderful thing because patients tell me all the time in the clinic out there how much they love going to one place where all of their health care can be handled. And we're all in the same, we don't share exactly the same EMR, but at least it's close enough that I can see all of their medical records. And so from a cooperative care standpoint, since I have access to their medical records, we can find out things and share information back and forth, because it is kind of interesting, as an aside, how many times patients come in, and if I look up their medical history, I'll see a slightly different picture than what they told me. Sometimes there's things that the patients tell me they don't tell their primary care providers. Sometimes it's the reverse. It's always good to share notes and be able to share things back and forth, because sometimes, particularly women, will see the dentist more often than their primary care provider. Guys tend to be low visit level on the dentist anyway, unless it's a crisis. But still, that speaks to what we're looking at next, because what we're about is teaching the dental students, educating the dentists, that in order for me to treat a patient, I know the teeth are connected to the rest of them. So I have to know and understand all of their medical history and how their medical conditions interact things with us. Going forward and out into the community, we're trying to build bridges where maybe treating dental disease is significant as far as the overall health of the patient. I'd like to think that I put enough information on the table today that maybe we should start thinking about ways to include dental metrics in your plan for health. I mean, you ought to get points for coming to the dentist on a regular basis. I don't know how the flossing would have to be the honor system, I think, but at least, we can track you coming to the office. I think there's some real benefits to that for people. And this is all about everybody working together. And, come on. There we go. So as we could see in the future, Now, our dental students are much better prepared to want to interact in a medical world because dentistry is becoming part of the medical community, and it's where we all kind of touch as we come together. It's a bright group of people that we're sending out into the community. They're highly trained. And what I'd like to have you guys begin to think about as you work with things is that because we know a thing or two, I know that's not true. So convincing people that it's all together, whole body health is all one part. I'm not asking for you to practice dentistry. That's my job. But what I am suggesting is when you're doing a routine physical or assessment of a patient, look in their mouth. I mean, one of the studies, a study just came out just this week. It's so new that this slide deck locked on Monday because it was put in the presentation, so I couldn't add this one in. But for patients in adults missing 2 or more teeth, not counting wisdom teeth, we're talking about teeth that the patient lost in adulthood. If you're missing 2 or more teeth, you have a 23% higher risk of cardiovascular disease. So we can run all kinds of lovely blood tests, and there's things we can do to check as far as risk factors and predictors, but a simple one is look in the patient's mouth. Do their gums look pink and healthy? Are they missing any teeth? If they are, ask them if they've seen a dentist on a regular basis. And if they haven't seen a dentist on a regular basis, encourage them to. Even make a referral to. That's why we're all here in the same community. I see patients all the time. In 30 years in practice, I can tell you the patients that I've been able to contribute in saving their lives by, we take blood pressures on patients every visit. If we find a patient that appears to have the signs of hypertension, and I'm not trying to practice medicine, but I will refer the patients to their primary care providers, we can get that treated. I was the initial person diagnosing a case of leukemia some years ago. So the mouth is one of the signs of the body. Health of the gum tissues, health of the mouth. They say the eyes are the windows to the soul, the mouth is kind of the window to everything else. And because gum tissue divides rapidly, let's look at our chemotherapy patients. Why do they lose their hair? Because cancer is a rapidly dividing cell structure. And so the chemotherapy agents that act on rapidly dividing cells get hair, skin, nails, the other rapidly reproducing cell layers. Gum tissue is one of those. So we'll see oral presentations for diabetes. We'll see oral presentations for some cancers, that type of thing. So what we routinely, if this is going to kill a lot of people, and so is that, we routinely look at risk factors in there, smoking, obesity, diabetes. What I'm encouraging us to do is to consider periodontal disease or oral health as another risk factor and something that we need to manage. So I'm happy to do that, but if we all look at the patients, if I see these signs, I'll send them to the medical side of the world. If you see signs that don't look right here, send them back our way, and in the end, it all works better for everybody. So this is the kind of overlap of where this all comes together. Now, I think that we have the opportunity, because we do collaborative medicine around here, to produce a much higher level of patient care. And I think that's something we should and could be very, very proud of at this point. We are the home to some of the finest training, but we can be better. And I think if we all work together to look at overall wellness and health, I think that's going to turn out to be a very good thing for all of us. The future of dentistry and medicine really is bright enough to need sunglasses. We need shades. But, we don't want to miss the boat. And as we move ahead historically, I'd like to think that that's why we lost these guys and not this. But anyway, they didn't have their Google calendars up to date. If there are any questions or anything that people have here, we'll take them now. If you have questions later at any point, certainly I'm out in Upper Arlington. You can contact me at any point or any of the staff. As I said, we have toothbrushes out in the back. And well, let's see what we have questions-wise.
Does anyone have any questions?
Question and comment, I guess. So
Okay.
I'm a speech pathologist
Great.
at Dodd Rehab Hospital. And so we look at a lot of the oral care literature with respect to reducing aspiration pneumonia risks, things of that nature.
Good.
And I guess in reviewing a lot of the literature, it's very confusing. Like you read various studies looking at oral care protocols, and it's very difficult to kind of figure out like best practice for the hospital, like what is best practice for oral care protocols. Some do toothbrushing, some include the flossing, some include mouthwash, some don't, some do it twice a day, 3 times a day. Like, have you come across a more standardized process? And number 2, kind of related to that, like I feel like there's a lot of maybe different oral care maybe protocols within the hospital, but nothing that's been standardized across the medical center as far as I know. And are there any initiatives to look at that?
The way I would answer that is anything that people would do or would be willing to do is better than nothing. So it is better than where we are now. So if we can raise the awareness and move forward into any kind of protocol at all, that's a huge benefit. Part of this discussion is in order to try and enhance an interest in developing protocols that work. You know, the challenge is each area of the hospital are going to have different needs. So if we can initially raise an awareness to get people to be thinking about establishing protocols, then we can certainly, through the College of Dentistry, assist with informationally any protocols anybody would have or would want to establish. You know, because some patients can assist themselves, they just need a reminder. I mean, some patients we have to do things for them and support that. But, you know, certainly from a standpoint, I tell patients this all the time with flossing, you know, 7 days a week is great. I'll take weekends. I'll take Monday, Wednesday, Friday. I'll take, you know, sunny days when it's 70 degrees outside, I mean, or only when it rains or when it snows or something like that. Anything's better than nothing. And so we'll move that forward as that. You know, the healthy 4, brush twice a day, floss once a day, may not be possible for every clinic for inpatients versus outpatients, that type of thing. But we're certainly here to help establish any protocols that you'd like. I'm just thrilled that you asked the question, you know, because we've opened a line of dialogue that I think could be very beneficial. Thank you.
Any other questions?
This one done, Fred?
In the hospital is hard. We're certainly not going to get them to floss. But in an extubated patient, would a Peridex rinse actually kind of help replace flossing?
It can. It doesn't, well, this gets back to the relative good, okay? Ideally, floss would be the best because we need to get under the gum line. And so the Peridex rinse still won't penetrate, Peridex is chlorhexidine. A chlorhexidine rinse won't penetrate the sulcus, but it's better than nothing. You know, in other words, it's a mild antibacterial rinse, so it'll kill superficial bacteria, so that's certainly better. The downside with the chlorhexidine rinses is it causes gray staining of the teeth, and about 10% of the patients develop a real kind of metallic-y taste in their mouth, and that's just an individual chemistry reaction to that. But a chlorhexidine rinse or even chlorhexidine on a 2x2 or 4x4 wipe on the teeth is certainly better than nothing. And, you know, brushing followed by that, once again, I'd take that. Flossing would be ideal, but that may be asking too much in that population. But if we continue to reinforce the value that this has for all of the patients, then I think that's going to be a key. Yeah.
Any other questions? All right, let's give
I think it's too sunny outside. So anyway, if you look, before we get there, if you look at the bottom of your salad, if it has an X on it, you get a door prize.
Or the top. Or the top.
There's 1, 2. So we have 2, okay?
More, yes. Who's?
Okay. They won't let me jump off the stage here. OSHA is said I'm too short to jump down that far, so, and I'll come down and walk. Back up there, right? Okay, I'll walk that up there. Okay, Anna, if you, this is the clinic coordinator for the outpatient care clinic in Upper Arlington, Anna Madden. Let me take one of these. If you could deliver that up there. Let's see, who's closest to the stage? You get the closest to the sage prize, and let's see, which is closer? That would have been too easy. Okay, of the three of you, anybody like a book? Okay, there we go. Perfect. You are welcome. If there's anything we can do to support your, now that I'm down, I'm stuck down here. If there's anything that we can do to support your care or the care of your patients, any questions you have, that's why we're here. That's the goal of interdisciplinary care, is to make that all happen. So, very good. It's been my pleasure being here today. Thank you so much.
I want to thank you guys for all coming out. Thank you, Dr. Messina. This was great. You guys were all given an evaluation form. If you guys could please fill that out, that definitely helps our team evaluate our programs and future programs. And there's also the clickers, the Turning Point clickers. There are boxes in the back of the room if you guys could return those. And thanks for coming.